here with my good friend Daniela, who I've met in the last few months that we've been here, and you and your husband Gustavo have been very kind to Brenda and I, so thanks very much. You've helped us with a few things. And I just thought it would be good to catch up with you, Daniela, because apart from being a mother and many other things, you're also an insurance agent, I understand. And it's something that we get quite a few questions about and wonder about ourselves, whether it be health insurance or insurance for cars or houses or whatever. And there's a lot of different views about the way that people should approach insurance in Paraguay. So I thought it'd be good just to have a chat about that and also about the healthcare system here, because you're a nurse, I understand,
Yes.
and you've had a lot of experience both professionally and also with your family in terms of dealing with the hospital system. So firstly, can I ask your advice about, there's often a question asked when people move to Paraguay, should they have insurance, health insurance in particular, or should they pay for things as things come up? And what's your position on that? How do you think that should be approached?
First of all, I appreciate the opportunity to talk to you. Well, I think when you go to a different country and you don't know what to expect there, I think healthcare is a very important point. Any place of the world, because we always get sick sometime, or the kids get sick, or they have a little accident at home, or they get caught or something, and so what do you do? So I think it's a good point if you go to another country to be safe about healthcare. Yeah.
As you say, when you're in another country, I wouldn't know where to start if I had an accident or something here. I understand that basic healthcare in Paraguay is free for everyone, is that right?
Yes.
But when we say basic, it can sometimes be basic.
Well, in Paraguay we have like two systems, the public system and the private. So the public system is free for anybody. It doesn't matter if it's Paraguayan or from anywhere. It's free for everybody. But the hospitals are dirty.
Yeah.
You often see dogs and cats, street dogs, running around, laying there because in summer there it is like a little colder than outside. Yeah. So they go inside and like lay down the ventilator.
Oh,
yeah. And so it is free, but sometimes or many times they don't have the medicines you need. So if they don't have it in the public hospital, you have to buy it. And so I really prefer go to a private hospital because in my opinion the attention is better as well.
And when you say that you have to buy the medicine in a public hospital, how does it work? Would a doctor say you need this medicine, go and find it, or do you go to a pharmacy, or how would that work?
They write it down and give it to you, and so inside of the public hospital there is a part of the pharmacy, and so you go there with your cellula or your passport, and if they have, they give it to you, but if they don't, you have to go outside and search for it.
Wow. And what about if you had to have an extended stay in a public hospital? Like, what sort of care would you get? Would you be fed, or would they look after you, or?
Well, first of all, if you have to stay at a public hospital, always another person has to be there with you.
Yeah.
Because they often need other medicines that they don't have, so that person that is there with you have to go outside and search for it and bring it back to them. And you don't get like food there. They bring you like a few cookies with tea, but you have to buy something to eat, so from outside again. Yeah.
So if you were here by yourself, or even with a family but you couldn't speak the language, it would be pretty difficult to be navigating the public system.
Yes, it is, because they also have like no patience. That is one thing I'm wondering about, because if you are a nurse it's because you have me, for example, I want to help other people. I don't want anybody to get hurt. I don't want anybody to feel pain. So I'm patient with them and like, how do you feel? Can I do something for you? You need something. That's me, you know.
Yeah.
But there in the hospital, I think they don't have any patience for the people there, and so they're short, they're cold, they're not kind. Yeah, so I really prefer the private one.
Yeah, you've convinced me.
Yeah, yeah.
So, do you use private hospitals yourself for your health?
Yes. So my daughter was born in a private hospital. That's another case. So in the public hospital, there aren't allowed men inside the delivery room.
Oh.
So, or anybody. Either man, woman, nobody. So if you are in labor and go to a public hospital, you are there alone.
Wow.
With no phone, just you in pain. And so my daughter was born in a private hospital. So my mom could enter because I was only 17 when I got her. So my mom was there for me. But when my son was born, I also went to a private hospital because I wanted my husband to be there with me. And so everything was fine. And the nurse was checking on me and everything. And then she told me, I don't know if it's true, but she told me, you know, your amniotic liquid is changing color. And that means that the fetus, the baby, is suffering. And I was like, oh my God, now what? And she said, well, you have to have a C-section. And I was like, no, because I wanted to have my son normal, you know?
Yeah.
And so at that time, I don't know if she wanted to like charge us more or if it was the case, you know, I don't know. But so we hadn't had the money at that time to pay for the C-section. And that's why we went from the private hospital to the public hospital while I was in labor.
Oh.
Yeah. So we got in the public hospital. She wrote down a name that we should look for the nurse in the public hospital. And so we got there, and I was in a wheelchair. And so my husband ran to find this person, and I was there and like in pain, in so much pain. And then one of my teachers came to me. Like when I studied nursery, I went through every station in the hospital, and so she was my teacher in the hospital, and she came along and she said, hey Daniela, how are you doing? I said, I'm fine, you know. And she was, wow, don't you want to go to the delivery room? And I was like, yes, I want to. And she was so, well, come on, let's go. And so she took me to the delivery room. And so there, my phone I had to give to my husband, and he had to stay outside. And I was in so much fear because I didn't want to have a C-section, you know. And so I entered in the delivery room, and there have been two other women, like in the same situation as me, like in heavy pain. And so they put me on oxygen, yeah, so that my baby would have more oxygen in the blood. And so then she told me, the nurse came and she told me, well, you come for a C-section. And I was, yeah, that's what they told me. And she said, well, we now only have one doctor, and she is now in a C-section with twins, so you have to wait. And I was like, oh my God, I have to wait, what will be happen to my baby? And you know, I was so nervous. But finally, from these two other women with me, 3, I was the first and delivered the baby.
Ah.
So I had him normal and everything was fine, but that's not how I planned it, you know. Yeah.
No.
It's an experience, but I don't recommend.
Yeah, but in that situation, it was lucky, I guess,
Yes.
that you knew people, you were able to speak the language.
Definitely.
Yeah, so without those things, it would have been a very different experience.
Yeah.
And have you had many other needs to go to hospital with your children for other things? How have you got on there? And has it always been private or has it been a mix?
Like first it was a mix because you know, like here in Paraguay it's cheap to live here, but also you don't earn much money.
No.
And so we went to public, but in public everybody is in public, you know, so you have to wait long times. If you want to have a consultation, you have to go like at 4 or 5 in the morning to get a number. And so if you are, I think they give like 20 numbers in the morning and 20 numbers in the afternoon. And so if you are late or you are number 21, so you don't get it. And so you have to come back in the afternoon like 12 o'clock to wait, to be in a line and to get a number. And so it's really is a lot of time you waste there waiting to be able to have a consultation with a doctor. So I prefer a private hospital.
In regards to private insurance, if someone was to get a private insurance policy, would that cover them just for Paraguay? If they travel to Brazil or Argentina, would they be covered?
Well, I represent 2 different companies. One is with international healthcare and for travelers, for example. And the other one is just for Paraguay, but we have there 2 policies that cover, but it's a short amount of time, like 20 days one policy and 30 days the other policy. So if you want to travel more, you have to look for another one.
Right.
Another policy, yeah.
Okay. And when you say it's for a short amount of time, is that when the policy first starts, or is that I've got the policy and then a year later I travel to Argentina and I can have that coverage? Yeah.
So in that policy, if you want to travel, you have to like give them a call or a message. So they prepare a special card, I think. So 1 week before you travel, you have to get them a call or give them an advice. And so they prepare it so that you are covered while you're traveling.
Right. And in terms of outside of Asuncion, what are the hospitals like? Like, say, for example, we're near Carcupe at the moment. Is there a reasonable private hospital in Carcupe, or would you have to go to the capital if you had something serious?
Well, in Carcupe we have 2 good private hospitals. So when my family has any health problems, we go there. Or in Eusebio Ayala, it's not far from here, it's another good hospital where we go. And to not go to Asuncion because it's far, you know. If you go to Asuncion, it's always 1 day because of the traffic and stuff, yeah.
Right. And what is the situation in terms of ambulance if you have to be picked up after an emergency or if you have a massive problem? Do you have to pay for ambulance here?
Well, ambulance is included in the policy.
Ah, I see. If you didn't have the policy, do you have to pay?
You have to pay.
Yes. Is it a lot or?
I don't think it's that much, but to get an ambulance always is combined with troubles.
Okay.
Yeah, because the public ambulances, like, they don't have gas. Many times they don't have gas. So if you have an accident, most time what will go there is like the firefighters with their ambulance, but they also depend on money they receive from kind people or because they don't have support from the government. So yeah, that's always a problem.
Yeah. So are there private ambulance services?
Yes, with the private ambulance services or the private hospitals, they have their ambulances, and so yeah, you have much more luck with them.
So in addition to health insurance, do you do dental insurance and orthodontics and things like that?
We have policies that includes
going another step in terms of insurance for cars and homes and contents and things. Do you deal with that sort of insurance also?
Yes.
And so is it more cost effective to have a comprehensive insurance package? Like, is there an incentive to have everything insured, or what's the best way to do that?
Well, I think it depends much how every person's mindset is. Yeah, because many people, they come here and they live like they don't buy anywhere to live, so they just rent. And so if you rent something, you don't
Yeah.
need an insurance. You
Yeah.
know? Yeah, but I would say a car insurance is important here because it's typically here, if there is an accident, like always the migrated people, it was their fault, you know, just to take
See.
money.
Yeah, yeah.
Yeah, so if you have a car insurance, you're on a good way.
Yeah, 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 yeah. And I think that's the thing about insurance. It's not only that you're insured, but it's also the peace of mind of knowing that you've got something behind you. You've got some sort of protective structure
Yes.
behind you.
Yes.
Otherwise, you're just pretty much left to the devices of the system.
Yes, and then you need a lawyer. Yes, you need a lawyer, and it's another thing with the lawyers here because everybody wants money from the immigrated people. You know, they think, oh, they are rich,
See.
I can take from them.
Yeah.
And so the prices go up.
Yeah,
Gringo prices.
yeah, yeah.
Yeah, and so you have to be.
And you have a unique, well, not unique, but a very particular position that you're in terms of being able to see these things happen, because you've lived here since you were young, is that right?
Yes, I'm almost here 15 years.
And you're married to a Paraguayan
Yes.
guy, and you've got a beautiful family, but you have the experience of walking in the shoes of someone that's just arrived here, because you're clearly not indigenous Paraguayan, and so I understand quite often you will get mistaken for someone that might have just arrived. And so you were recently sharing with me the experiences that you have where sometimes there's a different price for you when you walk in.
Yes, I often, when I go to some place to buy some stuff, like in the market, we often separate, and I look and like what I like, and I like give him signs. I ask for the price and they tell me the price, and so when I go on, and then he comes and asks for the same clothes or whatever and gets a different price.
See.
Yeah, so that's, we already know, so that's why we go separate, because
Yeah.
I'm blonde with blue eyes,
Yeah.
and they know it's a migrant person, it's not a Paraguayan woman, so gringo price.
Yeah,
Yeah.
see.
Yeah.
Yeah. Yeah. Some people think that doesn't exist, but unfortunately it does.
It does.
Yeah, we've
Yeah.
experienced that also, but just got to be smart about it and try and navigate your way through.
Yeah.
Talking about having support structures and being able to navigate these things, I understand you also are available to help people navigate their way through dealing with, say, a doctor or something
Yeah.
like that. So that's a service that you also provide?
Yes, because I know it's difficult when you come to another country, you don't speak the language or you don't speak it well, or if you are in a different situation and you're nervous, like your mind gets white. So yeah, I've been through all that, so I know perfectly how it feels. And so yeah, I speak English, I speak German, I speak Spanish, and a little bit of Guarani. I'm still learning. And so yeah, my husband, he is Paraguayan, so he speaks Spanish and Guarani. And so we make a good team
Yeah.
to cover everything, you know.
And I could only imagine if you had a serious health condition, how helpful that would be to have someone. I mean, I've been in situations just recently with my car, for example, where I've been trying to explain some of the issues with my car to a mechanic, and it's been really stressful.
Yeah.
And sometimes it doesn't work out well. So having someone like yourself, and also the fact that you've got that medical background.
Yes. Yeah, I'm open for everything you need.
Yeah, cool. So I guess if anyone's interested in exploring the options of any sort of insurance that we've talked about, or perhaps thinking about asking your advice should they have any health concerns, and it's just a matter of reaching out. We can
Yeah, sure.
put a contact detail.
Yeah, sure,
here.
definitely, yeah.
Yeah,
Yeah, we will find the perfect policy for everybody.
yeah, sure.
So yeah, what suits them best.
Yeah,
Or even if they bring, for example, if family comes and they bring one of the parents, like the grandparents, or you know, so we can include them as
Yeah.
well. So it's no problem.
okay. So you can add people. It sounds like it's pretty civilized and well organized. So
Yeah, Paraguay moved on in the last 10 years. It's incredible how it's developed.
Mm-hmm.
Because when I came, the streets were sand and stone, so just the highway was asphalted, yeah. And now you see the streets in the city are well done. You see a lot of cars. When I came, you had to have luck to see another car, you know. So nowadays, how many cars there are? So it's a huge change that Paraguay made in the last 10 years.
Yeah. You can tell by some of the driving habits that there haven't been a lot of cars on the road until recently.
Yeah.
So.
Yeah, that's true.
Yeah.
That's true.
Yeah, but you know, you get by.
You need to have a good honk. Yeah.
Oh yeah, that's one of the things I need to sort out with my truck. But
yeah, I'm glad I have my honk. It's working very well.
Yeah.
Just this morning I was like in the circle. You have preference in the circle, you know, and they were standing in the circle to let pass big trucks.
See.
And I was like, no, the truck has to stop.
Yeah.
We have preferential way, so
Yes.
I honked them.
Yeah.
That's things that make me angry because they don't learn to drive, and they just do it like they want to.
Yeah, but I wonder if there is actually any real law that's been created about we call it a roundabout, the circle. I wonder, because with the roundabouts in most countries I've been to, there's very strict etiquette about who goes before who.
We have that here, but the thing is, you can buy your license.
See.
So you don't have to do exam for license. So learning by doing.
See.
So if my mom or my dad does it that way, like they do it that way. You know?
Yeah.
Because they don't know better, but I get angry when I see stuff like that, because no.
It's not the German in you.
No, it's not.
Yeah, no. Well, yeah, we have our moments, but hey, thanks very much for everything. I think that it's been really helpful to get some clarity about the insurance situation. Everyone's got a different view on it, and I think that it really is something that everyone needs to make inquiries about to see what best fits them.
Yeah, sure.
But I think definitely with vehicle insurance, it sounds like a must.
Well, I have here like some flyers.
I see.
From every policy we have, but you know, these are flyers and we have changes like every year or something like that, but I also have all of these in PDF.
Oh, cool.
So if anybody is interested, I can just send it to them, and so they have a look through.
Yeah.
And so
we might even be able to create some links on our on our blog, or maybe at the bottom of the YouTube video. All really helpful stuff, and it's great to know that they can contact you and get more clarity about it. But yeah, I think definitely health insurance and car insurance sound like a...
Yeah, and one thing, I'm just, now that I looked at the picture, if you want to have a family here, planning having babies, and you want the epidural, you have to have a private hospital, because in the public hospital you don't get epidural. You don't get. So I respect every woman here, every mother here, because they deliver their babies in full pain. So I had an epidural with my daughter, but I didn't like it. So with my son, I said I don't want it. I want to have, because with my daughter I didn't feel when I had to push, and so I really didn't like that feeling that I don't know when to push. So my mom had to touch my belly, and so she said, now you have to push, and I was like, oh, okay, I will push. But yeah, in the public hospital you don't get an epidural.
Wow. Wow. Well, if ever I need an epidural, I'll be glad that I've got private insurance. But thankfully I can say I have no experience in that regard. Well, that's something to know, because there are people coming here who are planning to have families. We see younger people coming here, and couples, so another good reason to consider your options. Yeah. Hey, well, thanks very much. Really appreciate your time, and if anyone wants to contact Daniela, they can reach out through us, or there'll be links in the video description, and maybe might get something up on the blog, because it's a really important part of making the transition. It's probably one of the most very important parts. People are asking about insurance and healthcare, and just the fact that they can have you on the other end of a phone if something, you know, needs to be sorted out or translated. It sounds like gold to me. And you've helped us a lot in that regard, not so much with health insurance, but you've helped us a lot with our car, which we might make another video about, because that's kind of been like a health emergency in a mechanical form. That's gone on for like 7 or 8 weeks, and it's almost caused another health emergency, which has been a heart attack for me. Because, and I've certainly lost some hair over it, but it's all been really, the real cause of a lot of it has just been the inability to really speak on a technical level to the mechanic. And that has caused us a lot of pain, which I haven't even really spoken about on our blog and video, because it's hurt me so much. I mean, it's so traumatized. But now that we've got it all sorted, I'm going to make a video shortly and unpack that all. So yeah, it's been another big adventure. But thanks very much once again, and anyone that wants to reach out to Daniela, I recommend at least having a chat. It's really worth considering, because, you know, being in a foreign country, who knows when you might need some help. So hey, thanks again.
Thank you too.
Thank you, and until the next video, take care. Ciao.